I'm Dr. Azhar Alam, consultant gastrointestinal advanced laparoscopic and laser surgeon. And today we are going to discuss about a very important surgical problem known as gallbladder stones. A lot of us face this issue. There is an increasing number of people who are developing gallbladder stones every day. And there are a lot of misconceptions and myths about this particular problem. So today we're planning to discuss these things and clear a lot of this confusion. So let me start with a little bit of statistics. People often ask me that I have gallbladder stones. Do I need surgery? Is surgery needed? What will happen if I don't get surgery? In which patients are surgery needed? So first of all, we have to understand a very basic statistics. If a patient has had an acute episode or any symptoms regarding gallstone, there is an 80% chance that it will happen again. If a patient who has gallstones but who has never had any symptom, there is less than 20% chance that he will develop symptoms. So gallstones basically are divided into symptomatic gallstones, in which there are symptoms like pain, acidity, jaundice, etc. and asymptomatic gallstones, wherein you have just gone for an ultrasound for maybe a different issue and it is an incidental finding that there is a stone in the gallbladder. So in such group of people in which it's an incidental finding, you can be reassured that there is a less than 20% chance that you can develop symptoms in future. The next question which I'm commonly asked is, can gallbladder stones lead to cancer? This is a very important question and we have statistical data for this. So studies suggest that people who have gallbladder stones, there is roughly chances of 0.5 to 3% of people who will develop gallbladder cancer. So that means if you have gallbladder stones, there is a 0.5 to 3% chance that you will develop cancer in the future. So that means 100 people who have gallbladder stones, maybe 0.5 to 3 will actually develop cancer. But it is the other way around for people who have gallbladder cancer. Studies have shown that people who have gallbladder cancer or who are diagnosed as having gallbladder cancer, 70% of them have had a history of gallbladder stones. So that does not mean that if you have stones, it will lead to cancer. There is a very small risk that it can lead to cancer, but yes, gallstone is an independent risk factor for cancer. So the next question is, when do I need surgery for gallbladder stones? Most importantly, if you have had a history of acute pain, acute episode because of pain due to gallbladder stones, you definitely need surgery. If your gallbladder stone has caused pancreatitis, you need surgery. If your gallbladder stone has resulted in jaundice, you need surgery. There are also a certain set of people who are immunocompromised, people who are suffering from HIV, diabetes, people who are on immunosuppressants. Such patients need surgery for gallbladder stones. And there is another condition known as gallbladder polyp. So people who have gallbladder polyp greater than 10 millimeter in size, ideally they need surgery because gallbladder polyp independently is a risk factor for cancer.